Okay, good morning to you all. My name is Jane, as Claudia has alluded to, and I am from Ghana. This morning, my role is to give you some insights into lung cancer in Africa. I am from Ghana, but I would speak on behalf of Africa. Thank you. So this is the outline of my presentation. Answering these questions on what the burden of lung cancer is in Africa, and whether smoking cessation promotion alone would be a good intervention for us, the current state of lung cancer screening in Africa, and is lung cancer screening supported by our governments. To start with, this is just a picture of my hospital in Accra. That is the Premier Teaching Hospital where I work. And I start off with this diagram showing the map of Africa. And Africa is made up of 54 countries, divided into North, West, East, and the South poles. Mainly countries in the North, that is Algeria, Libya, Egypt, and the other small ones are known as the northern part of Africa, and they tend to associate a lot with the Middle East countries. In terms of economic footing, they are probably better placed with some better infrastructure. Below these countries is described as the sub-Saharan Africa, where there are a lot of economic challenges amidst conflicts. And then South Africa to the very end tends to be also better economically placed. Although they say that South Africa is one country, but has a bit of every world in there. The very challenged states, the well-to-do states in that respect. But looking to my right is the statistics from Global Cancer Observatory, and it's called the GloboCon in Africa. Now, they try to give estimates of what it is in terms of the incidence of lung cancer in Africa. You would see that West Africa, where I belong, seems to be the country with the lowest incidence. And then if you look at North Africa, quite significant. Eastern and others really very small in terms of incidence. And then South Africa definitely also higher, but not as much as North Africa. And this is incidence as in GloboCon statistics 2020. And these are the standings or the footings. In fact, it looks as if lung cancer then is not a problem especially in Western Africa, as well as the East. But then we always want to look at these statistics with a bit of some skepticism. Now, the prevalence that I showed on the previous slide mirrors smoking rates in these countries as well. If you look at this table that I picked from Business Insider, which was an article that was published, Tunisia has the highest smoking rates, and it is in Northern Africa. If you look at Egypt, the next one also has quite a good smoking uptake. And so you compare this to the incidence and it mirrors it. We know that in Tunisia, their country-specific incidence of lung cancer is very high, 37.6. If we look at this GloboCan statistics, it was a pool data, and therefore it gave them 16 point something, but individual countries record higher incidence of lung cancer. Again, West Africa smoking rates set to be very low. Now, I looked at this open journal publication that assessed tobacco smoking in sub-Saharan Africa, and this was 2018 to 2023. And the pooled data gave a prevalence of 8.8%. Comparing this to one publication in sub-Saharan Africa in 2019, the value was 2.9, which means there's increasing smoking uptake on the continent, and how does that reflect into lung cancer? We would look at that. As I said, we always wonder whether the global cancer statistics is reflective. Why that? Because we know that there is absence of comprehensive data on lung cancer in many of these African countries. And again, there's very little to talk about in terms of lung cancer registries. I looked at this 2023 report by WHO, and that was looking at the status of lung cancer registries on the continent. And it was quite not a good one. But that report touted the comprehensive registry that was found in Uganda and Zimbabwe. And then second to those countries was Malawi and South Africa. So looking at these pockets of data from the cancer registries, it stands to, we quite are concerned that are these statistics really reflective of the incidents? The other point is the lack of disease awareness and detection in these countries. Culturally, in most African countries, there's a lot of hashing on cancers, and not much advocacy groups. And so definitely detection is an issue. Misdiagnosis commonly as pulmonary tuberculosis. Again, this is anecdotal data. Hasn't been any objective studies on that. And then also low postmortem threshold practices. I mean, it's something that most people would also frown upon. Now, there's also lack of diagnostic resources, healthcare navigation limitations, and non-existent disease surveillance in most African countries. We look at that in spite of all this, we can confidently say that there is an increasing trend of lung cancer cases, particularly in sub-Saharan Africa. And this is reported in literature. So we can look at pockets of case reviews from Ghana, and then from Kenya, from Nigeria. All these things are coming up lately, and that gives us cause to worry. Why do we look at these trends and say that prevalence is increasing? Is it a real one? Or it's just because there's increasing availability of digital x-rays and CT scans in our part of the world lately? I tried to look for some information on the number of CT scans across Africa. There's very little data on that, but we can say that most countries are now getting these good imaging equipment, and that is probably increasing our pickup rates. Now, also, there are increasing presence of specialist skills. At first, we really did not have much in terms of interventional radiologists, pulmonologists. This is also increasing. And then we are also very fortunate to have influence from diaspora. Most people from Africa, in Europe, in US, coming back with educational materials. And here we want to say a big thank you to I-ELCAP, Claudia and David. Their influence in terms of exposure is helping us to identify these cases. And I want to say that that is also one of the reasons for the increasing trend of lung cancer diagnosis. Again, we also know that tobacco uptake is increasing and environmental pollution is a big thing. We know about a lot of mining activities, which is illegal in most African countries and a source of conflict. And we think that these are contributory factors to the increasing trend. Do we have peculiar epidemiology? Maybe yes, maybe no. Risk factors beyond smoking. We are observing this in most reports that have come from Africa. You would notice that about minimum average of 70% are found in non-smokers. In my country, 85% of our cases are never smokers. So it makes us think that we need to look at the aspect of epidemiology as far as lung cancer is concerned. Late stage presentation, rapidly progressive disease, is that true in our environment, or possibly we're just picking them up very late? We also notice predominance of adenocarcinomas. So I tried to show this data on mortality And if you look at the mortality versus the incidence, there appears to be some disparity. So even in literature, GlobalCan statistics says that the mortality from lung cancer globally, Africa contributes more than 50%, but this does not match the incidence. So probably we are not diagnosing them. A few of them may have postmortems, and that will probably be reported in the mortality statistics as shown. And you find Ghana there, and then we have average mortality from lung cancer. So based on the data we have so far from the little reports and the predominance of the disease in never smokers, the question from the organizers of this event, that is smoking cessation the most important intervention, surely it would help, but then we probably need to also look at the other factors that can be managed or can be identified to help mitigate the trend. I just want to chip in this. In my country, we've started the lung cancer MDT for just about over a year now. And interestingly, we found that quite a significant proportion of the cases were coming from one locality. And whilst we were discussing that, a colleague just chipped in that, well, I've read somewhere that there's increased radon exposure in that part of the country. And that was really interesting. And I thought that it's something that we could look into with our environmental agencies. So definitely there are other things that we could look out for, but without epidemiological data, that is very difficult. And that's one thing that we are working towards to ensure that our data is up to scratch. Status of lung cancer screening in Africa. Unfortunately, do I have much news on that? The concept is a great one and definitely will help us in our environment. But we do have some key challenges. And I've learned that to have a good lung cancer screening program, you definitely must be able to define your at-risk population. They should be able to convince policymakers on the size of the burden, and then the ability to demonstrate the economic benefit when they roll out such a program, and that is based on the number needed to treat formula. We haven't been able to do that, but despite these things, we definitely would want to roll up with this lung cancer screening because it's beneficial. The existing challenges have already enumerated a number, and that has to do with inability to identify at-risk population, defining pulmonary nodules in a TB granuloma predominant environment is something that we are working with I-ELCAP. We have been able to look at our TB data with regards to those who are being managed as smear negative or gene expect negative TB. Yesterday, one presenter alluded to that we have a lot of TB imaging and no one is looking at that. So with the help of I-ELCAP, we are looking and reviewing these chest x-rays of those that are categorized as gene expect negative. Of course, there are competing infections in Africa. Infectious diseases have always been on the top, but lately we have the non-communicable diseases coming up par with them and a major cause of mortality. And so most governments are now shifting focus. In my country, now there's a lot of talk about breast cancer, cervical cancer, screening not really taken up by the government, but lately a good effort had to do with providing HPV vaccines for women who are screened for cervical cancer. And so some efforts are coming in terms of policy change with non-communicable diseases. And of course, we do have our infrastructure and financial challenges that can always be overcome. So how can Africa tap into this good idea of lung cancer screening? Of course, we should work more on the epidemiology-focused research. Advocacy is ongoing at the moment to build knowledge and disease awareness. I would say that most countries have bought into this, and there's a lot of awareness as far as lung cancer is concerned. Policy statements are coming up. And I've seen a document by Lung Admission Alliance that is of Middle East and Africa, mainly for the northern sector, and then South Africa Thoracic Society. They have issued some guidelines on criteria for screening with a low-dose CT. We are prioritizing urgently on early lung cancer detection initiatives. In our case, we are looking at how best we can diagnose the suspected cases so that we can pull them together, so we can have data, we can help define and reduce misdiagnosis. With this, we can have numbers. And once we have numbers, then we can convince the policymakers. But as it is now, across Africa, there's really no governmental support in terms of push for lung cancer screening. There's a lot of work happening, Nigeria and Ethiopia from I-ELCAP, and then also from Bristol Myers Squibb Foundation, and they have a program called the Multinational Lung Cancer Control Program in Africa. And this is happening a lot with Eastern countries, in Uganda, in Kenya, South Africa, and soon we are hoping with I-ELCAP push from David and Claudia to have that in West Africa as well. In a nutshell, this is a paper by Amina and her colleagues, and they gave a comprehensive review on lung cancer screening in Africa. They enumerated well the challenges and how best we can surmount this. So this would be good for reading if we do have time. Thank you very much.